I think for me the most important finding in the paper was the connection between traditional male roles and avoidance of suicide, and the way that that men use that knowledge that they have to be the provider, they have to be the father, even father figure, I suppose, in some cases, the role model, and they use that to motivate themselves to get help or to at least avoid suicide. And I think that really spoke to me because several years ago, after my major depressive episode, but at a time where I had lost a job in law, and I lost a few jobs in law because, well, ultimately because I think I wasn't suited to it. But I had lost a job in law, and I saw my psychiatrist, and I said to him that I wondered whether it would be better just to end it all and let my family have the life insurance money. And he said that they needed me a lot more than they needed the money, and they needed the father. I have two kids, they were pretty small at that time. And he said they needed their father more than they needed the money, and that really spoke to me. And so I think that that's something that I really connected with in the paper. Yeah, my experiences around contemplating suicide and contemplating escape, I suppose the suicide is something that more resonates with me. I've never been into using alcohol or drugs or anything like that. But there have been times where I've thought that I wanted to end it all. I never made an attempt. And the closest I came was that time driving down the hill when I thought about taking my foot off the brake. But I think in terms of escape, I certainly had fantasies about being injured badly enough that I couldn't be expected to do anything, and that I could just lie in a bed all day and not be expected to do anything, or an illness that would leave me ineffectual, and so I could just do easy stuff all the time. That's, I guess, is the closest that I ever came to seeking escape. I never did anything about it, but that's the only thing I could think of for me that really fit that part of the study. I think in terms of upstream strategies and prevention of suicide, I think going back to the three factors that I talked about, the way to make men seek help earlier is to look at those three factors. First of all, the balance between going on the way you've been going on, and on the other hand, the stigma of admitting to having a mental health issue. If the stigma is reduced, if depression is seen as just another disease, another chemical imbalance in the body, like diabetes or like anything else, then that balance point moves up, as it were, and things don't have to get as bad before it's worth facing the stigma. The second point being knowledge that something can be done, and that's just educating people to understand that there are people out there who can help, there are ways to seek help, and that you don't have to go through depression. You don't have to just put up with it. The third factor was hope that something can be done. And again, that I think ties in pretty closely with knowledge of resources. And again, educating people that there is hope if you're depressed, and there is a better way to be.